그럼 second hour, we are going to start second hour. I just want to be sure, I want to be clear, you understand. 강유준, 김정원, 김태현, 김현중 이 네 학생은 우리 토픽이 무슨 토픽이냐면 여기 실라버스에 있죠. 그 spermatogenesis, vasectomy, fertilization, conception, same thing. STD and BPH. These are the 5, 1, 2, 3, 4, 5. So you choose one of the 5, write your research paper. Now research paper, I did not specify what should be. I think about 2 pages is enough. But the reason I ask you to do it, to learn medical terms. So don't forget, that's more important. So the contents, what it says, it's of course should be correct, but the reason I emphasize this one is just write down medical term as many as we can in both English and Korean, so that you know that is important name in that under that subject. So as I mentioned here, our medical terminology class will be emphasizing correlation. So on that particular system, what are those other terms? Correlation. So all related terms. And also I added, this is my challenge, convocation. Convocation is not medical terms, it's rather philosophical and theological terms. Means when you think about that term, what do you think? Is any concept comes in your mind? Let's say I'm writing on diabetes. Yeah, I remember my mom had diabetes and she has to go dialysis. Okay, then you write down about dialysis. And you have different terms in that dialysis. In other words, any terms, any medical terms are welcome. So do not hesitate to write down terms so that by learning it, so that you will have a foundation, tools to read medical textbook. Because that is going to be a book as long as you live. So that book, I have a book when I read in my medical school, right now in Los Angeles. So 50 years ago, I read a book, I carry it around because that book has my study history. In other words, I slept with the book, I carried the book, wet the book, and all those things. So it kind of gives you an idea. So remember, write the terms as many as you can. That is the major emphasis on this class. All right, and then attachment, either window format and PDF format. In 3 days, we're going to have another lecture. There's no homework, free lecture. In other words, you listened without heavy feelings of it. Enjoy. I like to make it fun as much as you can. So the lectures will be on pediatrics, analogy, and ethics in geriatrics. So that's all 4 heads I have on my head. 4 different specialties I have. I have American Board of Pediatrics, American Board of Allergy, and I have the master's degree of ethics, and I have spent here 11 months geriatrics in practice. So that is what I've done. So I want to give you an idea. One more, I wrote down are the page of textbook. It has lots of vocabularies on the subject what we learned today. So read through it, underline it, memorize the term. So when you memorize a term, that is your benefit, your wisdom, your weapon, whatever you may call it. Because that you're going to use it forever. So the term is very important for you. So let me then go over today's topic for us. Burnout syndrome is the one I'm telling you not to get it. In other words, of course, you are going to make diagnosis for your patient with burnout syndrome. Or you may observe your friend going through burnout syndrome. But I'm here to tell you that we don't want to get it. So this is doctor's disease. In other words, burnout syndrome is called compassion fatigue. Because you are compassionate with your patient too much, so you get fatigued. You're tired of it, so you get depressed, and it leads to suicide. Doctors have high suicide rate compared to other profession. So somehow, some reason in the United States, female doctors, lady doctors have more higher suicide rate somehow. I have no idea, no explanations. So these are the condition, burnout syndrome. This is the condition doctors, medical students, because due to intense competition and precise knowledge is required. When you make a mistake, you will be in big trouble. So that's the life and death concerns, you see. When you make a mistake with a car, you can just buy another one, or you can change it. But when you make a mistake with the body, there's no replacement, as you can see. So doctors are under very strong tension, strong alertness. If you make a mistake, life and death. So that's the problem. And also we do not have as much as other people, we do not have free time. So you spend quite a bit of times in your clinic, in your hospital, with your patient. Think about it. When you're intern residents, yeah, pretty much. And even after that, yes, you do spend quite a bit of time. And those patients will not come to you, make you happy. No. They will come to you telling you, I'm her doctor, help me out. If you help me out, I'll thank you. But if you don't, I will not thank you. So, that is the concern. So, the time I was thinking, maybe 10 hours a day you spend with the patients. So that is very strong stress. So stressful job, doctor's job, you all want it, you got it, lucky you, but again, you're heading for stressful time. So under the strong stress, we do get burnout syndrome. So it is important to recognize the symptom. Loss of interest. Oh, why did I choose this medicine? Oh, I have no interest. I'd rather do something else. I'm tired. Depersonalized. You are kind of cold. You kind of feel tired. You don't feel sympathy with other patients. You're irritable. So these are the symptoms you recognize. So the cure is to recognize early and you break off. You take your time off. It's okay to take 1 year rest. Yeah. It's better than having problem of strong and severe depression and the tragic situation. So it's important to recognize, to do that. So to get that early recognized and talk to your mentor, a bestie person, your family members, and tell them, help me. That's very important. I'm a doctor, but I'm sick, help me. So you need to ask help. Who's going to help me? Well, you have to find out. So there are many helps actually in the United States for those doctors with burnout syndrome, so that you will get good counseling and good help and good excuses and so forth. Because you are sick, not your fault. So remember, when you feel like burnout, ask, I need help. So it's very important. So again, what are my best defenses against the burnout syndrome? Mail that your answer to me by June the 1st, so that I know, aha, you're listening and also thinking about it, so that you know, oops, I'm in trouble. Doesn't do good. Oh, God, thank you. So that is, no slide. Okay, thank you. Now, so that is a topic, burnout syndrome, and this is new things, and also we do get burnout syndrome from Corona-19, and that also group burnout, so that is something unique. So I hope that we will someday we'll see face-to-face lectures, and we have to think about how we're going to do final exam. So we'll see. I will see what school says, school office says. And also I was told that your class, they voted against to have face-to-face lecture. So again, you communicate with school office, also Zenium, and so that we will have soon real lecture. Kozan will start their real lecture today. I'm not really sure why not. That's my personal opinions. Okay, now the another topic we're going to go over is sexually transmitted disease. Why is it important? Well, your patient will come to you. Yeah, I have such a disease, I made a mistake. Hey, doctor, help me out. You're the helper. You're not police officers. You're not so you need to make a good diagnosis and good treatment. Lucky these days. Long time ago, syphilis did not have any medicine. 606 is one medicine they used, but the Salvarsan they called it. It's not good medicine, lots of side effects. So the syphilis, it's some bad disease. Some people call the syphilis a consumption, but consumption means tuberculosis also. So any bad disease, you call it consumption. So syphilis also another conditions. But these days, penicillin is the best medicine, along with gonorrhea. Gonorrhea also, they use penicillin, and that cures the condition unless you get infected again. So that is something unique. So since we have penicillin, Gonorrhea, syphilis is treatable conditions. So you make a right diagnosis. When you treat, your patient will be happy. You will be a savior for those particular patients. Now, gonorrhea is a bacterial disease by Neisseria gonorrheae. That's the name of the Neisseria. Syphilis is not bacterial disease, spirochetes. Spirochetes, the syphilis. So that's two conditions. Now it's curable, and there are other antibiotics, even convenient more than penicillin. Because penicillin you have to have a shot, or many shots. But there are also oral medicines these days, more convenient. Some people call it more curable. So gonorrhea, syphilis, first penicillin. There are lots of other new antibiotics will take care of that. The third is funny names. And third and fourth, I'll do it together because they are names similar. Granuloma inguinale is a condition caused by the bacteria, Klebsiella bacteria. Treatment is azithromycin. Azithromycin is newer antibiotic developed from erythromycin, so that cures a condition. So when you make diagnosis, granuloma inguinale, it's swelling in the groin area. So that's the condition. Number 4 is lymphogranuloma venereum. Is so long names. It's all Latin. It's a venereal disease. It's a swelling of the lymph node, it says. But this is caused by chlamydia. Chlamydia is smaller than bacteria, bigger than virus. Rickettsial chlamydia. And that is treated with tetracycline. So again, you make diagnosis. And number 5 is herpes simplex type 2. Is herpes simplex type 1 is the condition with the fever blisters and herpes labialis, we call it, or in glossitis and so forth. But type 2 is genital area. It's sexually transmitted, very painful. There can be some medicine for this. So that's number 5. Number 6 is moniliasis, also called candidiasis, caused by the fungus called Candida albicans, and there's a medicine for it. HIV, everybody knows. There can be several medicines, not the cure, but prolonged life, as HIV is immunodeficiency viruses. And another one is trichomonas, the condition we call trichomoniasis. Treatment is metronidazole. It's by parasite, amoebic parasite. It's but we call it trichomonas because you can look at it on a microscope, and it causes symptoms and unique odors, discharge, and so forth. And the last is HPV, is human papillomavirus. HPV is known to cause cervix cancer when a lady has this infection in cervical area long time. So this is one well-documented cancer caused by virus. So the cancer is something has been with us since antiquities, long time. But it was not well studied until recent, actually. Some people called it, this is something unique. How come you got lip cancer when patient does smoke a lot with pipe smoking? So they said, it's unusual. Maybe irritation. How come chimney sweepers have scrotal cancers? That is maybe because of all the soot, that black one comes down and have irritation down into testicular area. So that's scrotal cancers. So chronic irritation is one reason. Second is virus can cause. Also X-rays can cause, including sunlight. There are many causes of cancers, including genetics, breast cancer. However, I don't think we have all the answers for the cancers. When you become a researcher, medical professors, you can study more to find out. But right now, HPV has a vaccine. So the vaccine will be given for the teenagers so that they will get immune to this particular virus. Even though sexually transmitted, that will not cause the cancer. So this is sort of preventable cancer treated by vaccination and prevented by vaccinations. So when you look at your textbook, page 334, 335, it does have name of sexually transmitted diseases. I think I added some few more. So I want you to read that part and memorize so that you will be a smart doctor. So patient doesn't know all these, they are not smart enough.